every business is unique. There are common challenges that occur with most companies that we talk to. The underlying issue most of the time is that the drug data is just not ready to go when they receive it. They must do things like map the drug data, consolidate multiple files, prepare for drug identifier changes, create workarounds for issues with the drug data, and manually apply each drug data update. This is costly, it's time-consuming work, and it places significant burden on their resources. So the first step is really easy. It's just realizing that it doesn't have to be this way. Drug databases often use technology, editorial processes, and delivery methods that are over 40 years old. Then the second step is really just a willingness to consider a more modern approach with Elsevier's gold standard drug database. Our database is designed by experts in the field who have extensive knowledge of the challenges of older technology. So healthcare companies see a large amount of IT, clinical, and operational benefits with Elsevier's gold standard drug database. I'll just talk about the three major highlights. So number one is true daily updates. Elsevier updates all of our content. That's product information, pricing, clinical content, and images every day, 7 days a week, including holidays and weekends. We do this to protect patient safety and also to help our customers operate their businesses most efficiently. Number two is ease of use. Elsevier's gold standard drug database has a relational structure that makes integration much easier and quicker. Customers are able to update their database on their own schedule, which frees up resources and time for their operational teams. And number three is operational efficiency. Elsevier does a lot of prep work with our drug files before we deliver them to our customers, which really frees up their resources. So I'll mention a few of the results from our customers who have switched from an older technology drug database. So one customer improved their updating schedule from monthly to daily, while still saving 8 hours of IT time per month. Another saw a 25% savings in IT resources because the data is easier to update and maintain. The QA team increased productivity by 13% because they have less manual testing to do with our database. A product support team increased their productivity by 15% because they receive less drug-related questions from their customers. And one of the most gratifying is that a customer told us they're using their internal resource savings to put towards innovative business practices in their field. Yes, absolutely. For companies who are expecting a reprogramming effort or who just want to expand on the drug data they currently have, now is a great time to evaluate both their short-term and their long-term needs. Many drug data users that consult with us are pleasantly surprised at the clinical, IT, and operational benefits that they could possibly gain with our drug data. Elsevier's drug information team, myself included, always works closely with our customers to identify their needs and come up with a plan to solve their problems. Visit elsevier.com/drug-database to learn more.